So, you're considering breast augmentation with fat grafting. There are a couple of things that you need to know before you actually have the procedure done. So hi, this is Dr. Roy Kim, your favorite Dr. Kim, plastic surgeon in Beverly Hills and San Francisco. Fat grafting is very sexy. It's very appealing because it's using your own body's tissue to really generate a beautiful result. However, the limitations include the following: the amount of volume that you can get, the overall shape and size of your breasts, and there are unique complications that you need to be aware of compared to breast implants. So first off, we need to do fat harvest, in other words, liposuction. At that point, I process and filter the fat, and this is where volume comes into play. In theory, if you have enough fat, I can give you a lot of actual fat grafting to your breasts, 200 cc's, 300, 400, 500. However, what we found is the fat in your breasts, when I place it there, needs to have good blood supply. So pretty much, it doesn't matter what the size of your breasts are, it doesn't matter the size of you, whether you're taller or shorter, it really doesn't matter actually the width of your breasts and other measurements. There seems to be a hard limit of around 300 cc's of fat grafting to a single breast, 600 cc's total, and that's sort of the maximum that can be safely achieved for fat grafting to the breast. Now, if you've ever had a formal breast augmentation consult, at least in the US, 300 cc's is sort of on the smaller size of implants that I place in my patients. So 300 cc's, and you can hold them here in your hand in my office, is not that much volume. The reason why is we have to maintain blood supply around the fat that I'm grafting. Also, the body does absorb some fat for almost any fat grafting and fat harvesting procedure. So I typically will slightly overgraft in other areas of the body. I'm expecting about 20% absorption of fat when I have to do it for trauma, reconstruction, or even cosmetic or aesthetic purposes. The breast area is no different. The second thing I mentioned is the overall size and shape of your breasts. In other words, you can't really have that much breast sag, what we call ptosis, P-T-O-S-I-S, for you to get fat grafting to your breasts. Breast augmentation with filler of fat really works the best in patients who have little to no breast sag. So the cool thing is that I can place the fat anywhere in your breast. There's a lot more customization. The downside is that if you need a breast lift or more volume in a breast lift, just doing fat grafting alone will generally not generate enough lift. You would still need a breast lift procedure, and you may actually want a larger implant or volume rejuvenation than what fat grafting can provide. Finally, there are a couple things that are unique complications to fat grafting to the breast. Breast implants, of course, have their own set of potential complications and risks. Fat grafting with fat includes the potential risk of forming a cyst, where there's a little pocket and it forms a little cyst there and it's filled with some substance. Those substances are benign. However, they can occur and they need to be monitored. Rarely, fat grafting into the breast can also cause calcification, which is a slightly hard nodule. And this is why breast surveillance after surgery is so important, and knowing exactly what procedure you had is also important as well. So even though those risks are pretty uncommon, they can happen, and they're very different from just getting a breast augmentation with implant. So I hope this video helped you. I now hope that you see that it's not necessarily the best thing or the worst thing. Fat grafting to the breast in the right candidate is a great procedure. If you have any questions, please let me know. Thanks so much for watching.